So this is the bone scapula. It's a triangular flat bone that lies on the posterolateral aspect of the thorax, overlying from the second to the seventh rib. The scapula has a medial, lateral, and a superior border, and a superior angle, a lateral angle, and the inferior angle. So when scapular body is in anatomical position, the thin medial border, this border of the scapula, it runs parallel to and approximately 5 centimeter lateral to the spinous process of thoracic vertebra, and hence this border is also known as the vertebral border. Now, and this glenoid cavity, this will face laterally forwards and slightly upwards, okay, something like this. Now there is the lateral border of the scapula. This runs supralaterally towards the apex of the axilla, and this border is also known as the axillary border. And this lateral border is made up of a thick bar bone, which you can see from this side. This portion is quite thickened, this whole of a region, and this prevents buckling of this stress bearing region of the scapula. Now this lateral border terminates into a truncated lateral angle of the scapula, and this is the thickest part of the bone that bears the broadened head of the scapula. This is a glenoid cavity, and it is the primary feature of the head. This shallow constriction between the head and the body, this part, this whole of this narrow region, you could see here, this is known as the neck of the scapula. Now, the superior border of the scapula, it is marked near the junction of its medial two-third and lateral third by suprascapular notch. This part, which is located where the superior border will join the base of the coracoid process. This is known as suprascapular notch. This is basically ossified here by suprascapular ligament. In this bone it is ossified, and this is transformed into suprascapular foramen. So when it's not ossified, this is known as suprascapular notch. And this superior border is the thinnest of all. You could see from this side also, more translucent. Now if you see the convex posterior surface of scapula, this is unevenly divided by a thick projecting ridge of the bone, and this is known as the spine of scapula, into the smaller one, which is known as supraspinous fossa, and the much larger infraspinous fossa, this whole of the infraspinous fossa. And this concave costal surface of most of the scapula, this forms the subscapular fossa. Now these three surfaces, the costal surface, the supraspinous and infraspinous fossa, these all fossa, this provide attachment for fleshy muscles. Now this triangular body of the scapula is thin and translucent superior, and in the inferior region it is quite thick and much more thicker around the borders. Now if you look on the spine of the scapula, this is the spine of the scapula, and this continues laterally as a flat expanded acromion. Now this forms the subcutaneous point of the shoulder and articulates with the acromial end of the clavicle. Then we have a deltoid tubercle of the scapular spine. This is the prominent surface you'll find here, indicating the medial point of attachment of the deltoid muscle. Basically the spine and this whole of the acromion, this serves as a lever for the attached muscles, particularly the trapezius. Now if you look supralaterally, the lateral surface of the scapula has a glenoid cavity. This glenoid cavity, it receives and articulates with the head of the humerus at the glenohumeral joint. The glenoid cavity is a shallow concave oval fossa. This is directed anterolaterally and slightly superiorly. That is considerably smaller than the ball, that is the head of the humerus, for which it serves as a socket. And then there is a beak-like coracoid process. It is superior to the glenoid cavity and it projects anterolaterally. Then we have spinoglenoid notch, the lateral border of the spine of the scapula and between the head of the scapula. This will form a spinoglenoid notch. These were some of its features that you must know here. Now, in the next segment, we will be looking at its major attachments. Thanks for watching.